All right, we're still in module 9, which is palliative care approach discussion. So this time we will be talking chapter 4D. This is the last chapter, sub chapter in chapter 4. So it's about pain, right? Remember, one of the main goal in palliative care is to making sure that we are managing the client's pain, right? Managing the client's pain, because one thing for sure, we want to give them the comfort, the remaining life, the quality care of life that they might have in the remaining hours or days that they have, right? So that's why pain is always a big pain management is always a big thing in palliative care approach. So when we talk about pain, guys, that means it's an unpleasant sensory or emotional experience. It could be physical, emotional pain, depends on the condition. It always be considered subjective. So the client will always be, or the person will always be the one who to tell us how the pain goes, how how serious the pain is, right? So it's subjective. So that's why we always ask the client, if you will tell me the pain level that you're experiencing. Zero is has no pain, 10 will be the highest pain. So how do you rate it, right? So that's how we do it. We will base the pain level or the pain level of the client based on what the client says it is. Okay, you will not assume the level of pain. It's always the client who experienced the pain will tell us the pain level. So we have different types of pain. We have acute pain, short-term pain. That means it's like it could be like happen just like now, and then in few days it will be gone. Chronic pain, it's long lasting, so it's having pain all the time. Maybe from a vehicular accident that affects the muscles or the bones. It could have a chronic pain, long lasting pain, right? Referred pain may be felt elsewhere. When we say referred pain, maybe like there's no, let's say I have pain in my left foot, but practically there's no left foot already because it was amputated. So that might be a felt a pain. There might be what do you call this? The client might be experiencing psychological pain, but there's no pain at all. Or it could be there's a pain. Let's say the client will say, "Oh, I have pain in my right chest, but it's actually the stomach that has pain, right? So those things. So what are the causes of pain, guys? Of course, injury. As what I've told you, it could be because due to vehicular accident or any accidents, illnesses, on it could be cancer, anything like that, right? So that will be some causes of the pain. If you had just had this, if the client just had a surgery, so the surgical site might give them pain after the anesthesia will subside. Also chronic conditions that might give them pain, like rheumatoid arthritis. What else? Those are some of the pain also that the client might experience. So the signs and symptoms of pain, make sure the client will have verbal reporting. They will tell you that they are experiencing pain. Facial grimace, when the client is showing uncomfort, facial gestures, that might be a potential pain. So you will ask them, right? Guarding, like maybe they are like start guarding their stomach or their chest or whatnot because they are experiencing the pain on that area. And the client will feel restless, like feel looking tired because maybe they don't have enough rest because of the pain that they are experiencing, right? So those are some of the common signs and symptoms if the client has pain. So what are the effects of pain, guys? So again, reduced mobility, that will actually big thing because the client will stop moving because of the pain that they're experiencing. There might be some sleep disturbances. They cannot sleep because of the pain level that they have. Emotional distress as well. They might get too emotional because of the pain that they have. They might be anxious. They might not be so friendly. The client might be so irate, right? So those things, and it might lower the quality of life, which we don't want that to happen in a palliative care. So that's why in palliative care we always manage the pain. So pain assessment, as what I've told you, pain scale 0 to 10. 0 will be no pain, 10 will be the highest pain. You need to observe the behavior of the client. If there's any changes to pain level, ask the client all the time, how's their pain going, where's the pain, and scale or rate the pain, right? And assess the client regularly based on what you can do as a PSW. So again, same role as a support worker. Make sure you observe and report whatever pain that the client is experiencing. If the pain is subsided after a pain management, assist the client comfort if they ask you to like reposition them or turn them side to side just to reduce the pain, then assist them. Follow whatever in the care plan as well. And managing the pain of the client, always important that we follow what's in the care plan and always be of support to them, right? Always be of support to them. So how do we manage the pain? Of course, for the nursing perspective, we manage the pains through medication as prescribed by the doctor or by the physician. Positioning, you can do that as a PSW. You can always reposition your client and show and give them the comfort that they needed. Relaxation technique, you can also do that by inhale, exhale, playing relaxation music or calming music in their room, anything like that. Heat and cold therapy, some PSW can do that too, as long as you guys are trained by the nurses. Because one thing for sure that we need to take into consideration of the heat and cold therapy is to not burning the client's skin, because their skin, especially if elderly people, it's very fragile and vulnerable. Okay. So comfort measures again, make sure there's a quiet environment if the pain is high, gentle care for the client, give them reassurance that it will be okay, and proper positioning, right? Proper positioning is the key. In terms of communication, make sure to actively listen to the client. Even they're like looking upset and mad because of the pain that they have, still active listening. Okay? Take pain seriously. If the client says there's pain, there is pain. Okay? Even if you think there's no pain, but there is pain. Report any changes to your supervisor or even to the other PSW that you're working with, especially during the shift change, and make sure to you be professional, use a respectful language or manner, and make sure that to communicate with them professionally to your client, to your coworker, and even to the family members. Documentation, record the pain level that the client stated, note whatever intervention that you have done in the nurse, and make sure you document the response if the client's pain subsided or whatnot. Okay? Again, reminder, pain is subjective. It's only the person that will tell how much pain they are experiencing, or if they have pain if they're experiencing pain. Never ignore the pain. It's always needs attention. Act promptly. If the client said there is pain, you need to act immediately, and make sure you work together as a team with your coworkers to achieve a continuity of care. All right, so later on we will have a short essay question with about the chapter 4D. So for now, that's it, and I'll see you again next lecture. Okay, next we will still have another slide, so we will be discussing that later on. All right, thank you.